Dear ladies and gentlemen, what we are discussing today is people's lives and how long, productive and healthy those lives are. If we are lucky, we will all experience being elderly. The European Union's respect for the indivisible, universal values of human dignity, freedom, equality and solidarity means that older persons must fully enjoy these rights too. When they do, the whole of society benefits, economically, socially, politically. This is where healthy equals wealthy. Enjoying these rights throughout the whole life cycle from birth to death and ensuring opportunities and fairness for all generations is the focus of my role as Vice President of the European Commission for Democracy and Demography. Our work on demography shows that our union is aging. We need to have a conversation about the challenges and opportunities this brings. The Commission's recent report on the impact of demographic change contributes to this by providing a fact-based reference for future policy making. Addressing demographic change is key to building a fairer and more resilient society. Indeed, addressing change means finding new solutions and stimulating innovation. We must find different ways to respond to the needs and talents of our citizens, to establish trust, solidarity. Knowing the impacts of demographic change contributes to this at all levels, local, regional, national and European. We see how COVID-19 is creating unprecedented challenges for our health, our economy and our social well-being and highlights the importance of addressing demographic changes. First, the virus has not hit every member state in the same way. Secondly, it has not hit men and women in the same way. Thirdly, it has not hit the young and the elderly in the same way. A better understanding of a country's demographics, its age structure, its population, concentrations, household structures, or intergenerational interactions helps inform policy responses, not least in how we recover from this health and economic crisis. Indeed, in the current COVID-19 context, it is necessary to discuss the difficult issues of social isolation and mental health. Our recent report on the impacts of demographic change highlights these issues. The current pandemic has brought the issue of loneliness out into the open. Loneliness must be addressed in terms of the global longevity dividend. COVID-19 has helped everyone realize the importance of putting older people and their needs at the center of policy making at all times. In early 2021, we will present a Green Paper on Aging with the aim of launching a wide debate to discuss the long-term impacts of aging, care and pensions, active aging, and the capacity of social protection systems to deal with an aging population. We will look at intergenerational solidarity and fairness, impacts on the labor market, the economy and health, and care systems. We will look at how the prospect of longer life expectancy can impact choices that are made by younger people. Let me be clear, aging concerns all generations, not just the elderly. Our Green Paper on Aging is needed because Europe is an aging continent. In addition, people are living longer lives. Given these twin developments, a broad debate on how best to manage this good news is required, because it is good news. Over the last 50 years, life expectancy at birth has increased by 10 years for both men and women. Living longer in better health is one of the highest expectations of citizens of the European Union. This brings challenges and opportunities for us all, including older persons. There is no need to paint the elderly as victims. Many are active, healthy members of society who volunteer, support families, or care for grandchildren. During the pandemic, older doctors came out of retirement to help the overwhelmed health sector in various countries. The elderly have a lot of knowledge and experience to share. Let us consider intergenerational training programs from which we can all benefit. Let us harness the potential that goes with the elderly being a category that is a significant economic driver. With an increase of chronic diseases, professional staff shortages, and the growing demand for accessible, good quality services, we must discuss revamping long-term care systems in view of the rising long-term care needs and future health crises. The emerging silver economy provides opportunities for the health and long-term care sectors. It can be a driver of innovation and research, enable SMEs and startups to launch new ICT solutions, and produce highly skilled tech jobs. Approached this way, the silver economy can be a driver for employment and the economy more generally. I want to dwell a few moments on active aging because it means growing older in good health, it means continuing as a contributing member of society, and underpins the rights of the elderly. It also means keeping healthy, volunteering, helping the family. It can mean grandparents looking after grandchildren when adult children are working, a beautiful example of intergenerational solidarity. Children are also our future, and we are preparing a new comprehensive European Union strategy for the rights of the child, so we work on the full life cycle. Active aging also means participating in our democracy. For example, in local communities and municipal councils. As Vice President with responsibility for democracy and the Conference on the Future of Europe in particular, I look forward to hearing the voices of the elderly in our deliberations. Active aging also means being able to fully participate in society. Today, we inhabit a digitalized world. Digitalization and technology helps older people in their autonomy and ability to connect with others. It also raises issues on the right to privacy. This calls for action in increasing digital literacy for older people. Digital tools must be accessible and easy to use for all ages. Let us not forget intergenerational solidarity. It is a matter of fairness and equity that policymakers cater to the needs of all generations in a sustainable way. Enhancing the active and positive role of older people in our society is key to addressing aging. In July, European leaders agreed to a package of 1.8 trillion euros, which combines the next multi-annual budget and Next Generation EU. The latter provides us with the means to address the consequences of the pandemic, but it is also a call on future generations to help us to cope with the challenges of the present day. Dear ladies and gentlemen, if we learn one lesson from the COVID-19 pandemic, let it be the importance of solidarity. This will be one of the key messages in the Commission's Green Paper on Aging, which will launch a much-needed debate on all aspects of aging and will look into how we can and should respond. We can see already that a more comprehensive approach is required, addressing economic resilience and healthy and active aging. Indeed, this is where healthy equals wealthy, where everyone can share in the richness of life in all senses of the term richness, where the young, the old, and everyone else in between contributes to true solidarity, which is a two-way street as we look to our common future. Thank you.